A special thank you to each of our subscribers who make this channel possible. Here's today's story. In a surprising move that has sent shockwaves through the public health community, Health and Human Services Secretary Robert F. Kennedy Jr. announced on Monday the complete overhaul of the Advisory Committee on Immunization Practices, ACIP, a key panel that advises the Centers for Disease Control and Prevention, CDC, on vaccine recommendations. This decision comes amid growing concerns about vaccine hesitancy in the United States and the need to restore public confidence in immunization practices. Kennedy's declaration, made in an opinion piece for the Wall Street Journal, emphasized the necessity of a clean sweep to re-establish trust in vaccine science. By removing all 17 members of ACIP, Kennedy aims to bring in new advisors who align with his vision for public health. The ACIP is composed of independent medical and public health experts who rigorously review vaccine data and make recommendations that influence vaccine eligibility and insurance coverage. The CDC director must approve these recommendations for them to become official policy. However, the future composition of ACIP remains uncertain, as Kennedy has not disclosed who will fill these critical roles. Despite the upheaval, the HHS confirmed that ACIP will still convene for a scheduled meeting from June 25th to 27th, during which new members will reportedly lead the discussions. This latest action is part of a broader trend under Kennedy's leadership, which has included halting routine COVID-19 vaccine recommendations for healthy children and pregnant women and canceling initiatives aimed at developing new vaccines for potential future pandemics. Kennedy's approach has been met with skepticism from public health experts, many of whom fear that his actions may further undermine vaccination efforts in the U.S. Critics argue that the panel's removal could exacerbate the already existing vaccine hesitancy and misinformation. Former FDA chief scientist Jesse Goodman voiced his concerns, labeling the firings as political meddling that could diminish public confidence rather than enhance it. Kennedy defended his decision by claiming that the previous committee was plagued with persistent conflicts of interest and had become merely a rubber stamp for vaccine approvals. He highlighted that many of the current members were appointed by the Biden administration, and their continued presence would have obstructed the Trump administration's ability to appoint new members until 2028. The HHS reiterated that all advisory panels maintain strict conflict of interest policies, and there have been no documented issues of misconduct. As the public awaits the new appointments to ACIP, the implications of Kennedy's actions on vaccine policy and public health remain to be seen. The upcoming meeting will be closely watched as it could set the tone for the future of immunization practices in the U.S. and potentially influence the ongoing battle against vaccine misinformation. With public trust in vaccines at a critical juncture, the decisions made by the newly formed ACIP will be pivotal in shaping the future landscape of vaccination in the country. That's all for this story. We upload videos every day covering many different subjects, so hit that subscribe button to stay informed. Thanks for watching.